And I'm going to pick up right where I left off on the last talk. We finished talking about John Hunter and the extremely experimentally based improvement he made in surgery in England at the time. So over the course of his lifetime, surgery went from being a slightly suspect and kind of lowbrow profession to something that was actually incredibly well-grounded scientifically and had a high degree of social kind of cachet to it. Now that same process happened in France, but it happened all at once. And it happened because, okay, there we go, because King Louis XIV had an anal fistula. Now, if you think about French kings and you don't know much about history, if you're thinking of any famous French king, you're probably thinking about Louis XIV. The Sun King, reigned for a very long time, very famous. He was miserable most of his life with lots of medical problems, some of them products of the time, others brought just societal problems. It was said that he bragged that he bathed twice in his life. And it said that you could smell the king coming and that people were told to throw open the windows before he came in because bathing at that time was not considered to be something that you ought to do. It was considered to be unhealthy. And it was, because everybody wanted to be like the king, a lot of people didn't bathe at the time either to emulate that. But his life was pretty miserable medically, and not the least of which was because he had an anal fistula. And so the court barber surgeon, a guy named Charles Francois Felix, was told, you need to do surgery on Louis XIV to correct his anal fistula. And if you're going to do surgery on the king's anus, you better not mess it up. So he did lots of experimental procedures on anal fistulas. He basically worked on people who were condemned prisoners in the French prisons and did preparatory surgeries. None of them succeeded. Everybody died. But when the time came, he operated on the king, and he was actually able to correct the king's anal fistula. And because of that, the king said, hey, surgeons are pretty useful. I think you are all now endowed with the Royal College of Surgeons, and you get to be respectable. So all at once, surgery became respectable in France. I have to believe that maybe his longevity was due not to any massive increase in the technical expertise of Felix at the time he did the surgery compared to all the prisoners he did the procedure on, but maybe because if you're going to operate on the king, what do you do to the instruments first? You probably clean them, which would not have been the case because there was no concept of a germ theory anywhere else. So he probably operated from one person to the next with the same tools until it got time to operate on the king, at which time the tools were probably cleaned and may have had something to do with the fact that the king survived. So surgery suddenly became very, very acceptable in France. And it was discovered that having a corps of capable surgeons going along with the army was far better than having these high-status physicians who refused to touch anybody and just kind of pontificated on what the problem might be. So it didn't take very long for people to realize that the surgeons were not only useful, but they were actually an improvement over some of the other medical professionals that were around at the time. And eventually, after the French Revolution, the distinction between the physicians and the surgeons and the barbers was just completely wiped out, and they were just referred to as health officers. And surgery, pharmacy, other sort of practices were simply subsumed under that one heading. Now, surgery has become a little more prestigious, so social acceptability is no longer a problem, but there are two major problems keeping surgery from being acceptable. One is the fact that it's incredibly painful. There is no anesthetic at the time. So normally what is done is that surgeons operate in tall towers attached to the hospitals, far away from the other patients, so the other patients don't have to hear the screams of the people who are having procedures done. Typically 4 to 5 large interns or large orderlies were holding down the person's limbs, holding them in place so the surgeon could do the job of amputating or excising a tumor, something of that nature. And essentially, speed was of the essence because it was not something that could be done painlessly. You had to do it very quickly. One of the most common amputation tools at the time was called the falciform knife, or kind of hook-shaped, beak-shaped knife. And it was because to amputate a leg, you'd have the knife in hand, You reach as far around the leg as possible and try to make one clean circular cut to go as deeply as possible, as quickly as possible, before the person struggled free. Now, the other problem we had was that there was surgical infection. Because we didn't know anything about germs, we didn't know about how disease and infection was caused, it was very common to have people become infected and die of bacterial infection after the procedure had been completed, even if it had been completed well and would have healed otherwise. So the first barrier to effective surgery was the discovery of anesthesia. And let's give a little round of applause. This is the first thing America did for the contribution to the history of medicine. So yay, USA. Now get ready to buy back all that applause because this is a horrible story. So, back in the day, in the 1800s, we didn't have TV. There were, maybe some theaters where you could see performances done, but it was very uncommon. People had to find fun things to do. And one of the fun things people would do instead of going to the movies or watching TV, is they'd go to laughing gas parties, which is exactly what it sounds like. People would bring nitrous oxide around. People would be invited up on stage to sniff nitrous oxide. They'd get a little silly, everybody would laugh, then they'd go back to their seat. And at one of these laughing gas parties in Massachusetts, a dentist named Horace Wells was participating, and as he went back to his seat, the story goes, there's a couple conflicting versions, but the story goes, he rammed his knee into the seat in front of him. But he didn't realize that it hurt until the next day. He completely was oblivious to the pain. Being a dentist, he thought, I could maybe use this to pull teeth. And he did. And it worked really well. And he thought that maybe there could be applications beyond tooth pulling for this sort of insensibility brought on by nitrous oxide. So he talked to the most prestigious surgeon in Boston at the time, a man named John Collins Warren, very well-respected, seasoned surgeon, and asked him if he could come to the surgical theater and try nitrous oxide as an anesthetic. Warren said okay, but the patient backed out at the last minute, decided he didn't want to have the surgery done, and so at that point Horace Wells offered to pull the tooth of any of the medical students who happened to be there. So imagine a situation just like this, except instead of being on a stage, we'd be down low, the students would be sitting up high, invite you all down, and somebody gets to come get their tooth pulled. He pulled the tooth, and here's the thing. The student later claimed that he didn't feel any pain when the tooth was pulled, but when it happened, he let out a yell, a little bit of a yell. At that point, everybody thought this guy was a fraud, and they just kind of basically drummed him out of the room, just shouted abuse at him, told him he was a fraud, a quack, etc. And apparently the most damning thing they yelled at him was, come on, clicker, there you go, humbug. So apparently humbug was a never forgive sort of insult back in the day. So he was humbugged out of there, and then could have dropped, might not have gone any further, but a student of his, a guy named William Morton, thought, laughing gas parties provide some insensibility, but there's another thing that happens when we go to ether frolics. And an ether frolic is exactly what it sounds like. You go up on stage and you sniff ether and you get silly, and everybody in the audience laughs and we all have a good time. So he decided that he wanted to test ether as a possible anesthetic. And it worked very, very well. In fact, better than nitrous oxide. And he was able to come up with a little device here on the right that was used to allow ether to be inhaled. Somebody would get insensible, could pull teeth. And nearly a year to the day that his teacher, Horace Wells, was drummed out of John Collins Warren's surgical theater, this guy, William Morton, came in and did the same thing using ether, except in this case, it was not a tooth extraction. It was the surgical excision of a massive salivary gland tumor, a surgery that was going to take at least 20 minutes. Now imagine again, a salivary tumor growing in and around the mandible, no anesthesia. You have to hold the person down and try to extract this massive tumor. Think about all the vessels, all the nerves that are present in this area. Bad news. So the ether anesthetic was applied, the patient passed out, and the procedure went on without a hitch. And essentially, the patient actually woke up after the procedure and asked, when are you going to start? So it was clear that this was a massively important thing. Painless surgery was now real. And John Collins Warren was remarked to have said, Come on, I think the battery might be going to the clicker. Gentlemen, this is no humbug. So I'm not the guy for it, but if anybody here wants to bring humbug back, I will be very, very pleased and chuckle as that goes. So this is obviously an important thing, something that really should be spread widely. But William Morton, the guy who used ether in the first place, he was a real scoundrel. He was a con man. He'd actually been drummed out of several cities for various cons, attempting to marry people under false pretenses for their inheritance, selling quack solutions, etc. And he decided, instead of telling people that it was ether, which you can't patent, he tried to come up with ways to disguise it with other scents, other dyes, and called it lithion. Here's the problem. A Harvard chemist who had worked with him to get the ether, a guy named Charles Jackson, said, hey, I helped you with this. You need to give me equal credit. I need equal billing, equal share in whatever profits we're going to get from this. Now, Jackson was a bit of a weirdo as well. He was really sensitive to kind of perceived slights, and he'd already asserted that Alfred Nobel had stolen TNT from him, Morse had stolen the Morse code from him, and various other people had taken credit for his discoveries. So he was not going to let anybody take credit for something he thought belonged to him. In this case, he thought the surgical anesthetic, ether, should be something he got as much credit for as Morton. So the two of these guys started fighting publicly, just constantly sparring with each other in newspapers. The Civil War happened. One thing that's interesting about the Civil War is we had anesthetic available in the Civil War, just not in enough quantity or on the front lines to make a difference when people were having their limbs sawn off as quickly and rapidly as they had to in the Civil War. So these guys tried to help the government out, make sure that everybody could get access to the ether, even though they were still trying to claim it wasn't just ether, it was something else. So eventually, the entire US government got sick and tired of this massive public feud. This is the first big American scientific medical advance, and these two were making it a complete mockery by just shouting at each other and constantly undercutting one another. So the US put up a $100,000 prize. That's in 1860 dollars. $100,000 prize for the person who could prove precedence in discovering surgical anesthesia. Morton jumped into his cab and went down to DC to try to press his case, but along the way he had a massive stroke and died. And there is, whoops, wrong way. There's his grave. Now, several years later, Charles Jackson, the other guy who'd been feuding with Morton all this time, hated him intensely, was attending a funeral in Cambridge, Massachusetts, and came across Morton's grave. And what does it say on Morton's grave? It says, William T.G. Morton, inventor and revealer of surgical anesthesia, by whom pain in surgery was averted and annulled, before whom in all time surgery was agony. Jackson read that and went acutely psychotically insane and never recovered. He eventually died in an asylum, and of course, he's buried in the exact same cemetery. So if you're ever in Cambridge, Massachusetts and want to skulk around some cemeteries, you can actually find these tombstones. One final note. 4 years before Morton had done his demo in Boston General with John Collins Warren, a rural doctor in Georgia named Crawford Long had excised small growths and tumors and done very small amputations with ether. And he didn't think it was anything that groundbreaking. He was claimed later to have been kind of waiting, biding his time to get a few more cases in to publish, but it was only when the $100,000 prize was announced that his friends and colleagues really pushed him to try to put his case forward. He was actually a very humble, not very kind of showman-like person, and he never got the money either, but he's credited as being the first person to do ether anesthesia. And he eventually actually was the only one who died in any kind of a way that seems dignified. He was delivering a baby and felt kind of the darkness growing in around the periphery of his vision, handed the baby to the nurse and dropped dead. So of all the people in this horrible, sordid story, he's the only one who kind of came off with any sort of dignity. So Crawford Long in Georgia, 4 years before Morton, had done ether anesthesia. Now, people weren't dumb. People knew that ether was a major component of what was being used, and word was spread very widely, but under the table, to surgeons throughout the world, and people started using ether. In England, A Scottish surgeon, but operating in England, Dr. Robert Liston, had really tried a few different things. He was a very experimental person. He tried a few different things to annul pain. He did mesmerism, trying to hypnotize people before surgery. That had some success, but it took a really long time to get somebody into that kind of a funk state where they're able to be insensible to pain just through hypnotic suggestion. So he decided to try ether, and it worked really, really well. And he is quoted as saying, another great little anachronistic thing, "This Yankee dodge," meaning ether, "beats mesmerism hollow." People just talked a lot more fun back in the day. Now, Liston is renowned as one of the quickest operators in the world. He would just basically come in for an amputation, and he'd tell all the medical students or people in attendance, and people would come to watch these for entertainment. He'd tell them, "Time me," to see how quickly he could do the amputation. His record was 2.5 minutes for a full amputation at the thigh. And essentially, there's a lot of great stories about him. He got in fist fights with other anatomists and surgeons up in Scotland in front of their class. So if you can picture, I don't know, who should I get in a fist fight with in front of the class? Oh, Dr. Griffith? Oh, I couldn't punch Dr. Griffith. Dr. Ridges is my boss, so I'm not going to get in a fist fight with him. But if you can just picture the faculty having a fist fight, that's the sort of thing that was going on back in the day. He was a little too quick on certain amputations, and one time removed both of a man's testicles along with his thigh. And he's also, the great story about him is he had an operation that had a 300% mortality rate. So in the process of removing a man's thigh, he accidentally amputated 2 of the fingers of his surgical assistant. And when that was revealed, he kind of jerked back and his knife went flying towards the assembled crowd. It didn't actually cut anybody, but an older man in the audience who was attending to see the amputation had a heart attack when he saw the knife kind of flashing up towards his face. The patient and the assistant both died of gangrene thereafter. So 3 dead for a single operation, 300% mortality rate in that procedure. But one thing Liston did was he was very, very eager to embrace this ether anesthesia that would actually make surgery far more practical and less traumatic for the people undergoing it. Another person, James Simpson, decided that ether was good, but they should experiment on some other substances. And he would invite friends over and they'd sample some other chemicals to see if it could induce the same state. One night, they decided to sample chloroform to see if it might also work as a good surgical anesthetic. And the story goes, they sniffed the chloroform and then woke up under the table. So it knocked the whole room out. Thankfully, there was a little bit of ventilation so they didn't suffocate. But chloroform quickly replaced ether as the go-to inhaled anesthetic for surgery. It was less irritating. It worked more quickly as well. And it began to be used not just for surgical procedures, but also for childbirth. Now, one thing that at the time, it was very controversial to apply any sort of anesthesia in childbirth, and one member of the Church of England was said to have quoted as saying that doing so would rob God of the deep and earnest cries of a mother in labor. Yeah. But that controversy ended very quickly because John Snow, the same guy who figured out that cholera was spread through the water, used chloroform to help Queen Victoria deliver one of her children, and once the Queen does it, debate's over. So chloroform anesthesia was something that was used regularly thereafter and made surgery far more pleasant. But it might be pleasant, but what's the major problem that's still lingering? What haven't we solved yet? Infection. There's still a lot of surgical infections going on. The person who was able to bring that to an end was Lister, Joseph Lister, of Listerine fame. He didn't invent it, but it was named in his honor. Lister was actually in attendance the first night that Robert Liston used ether in amputation. So he was present the first time it was used in the UK and saw the era of painless surgery come along, but he was very upset and couldn't quite get to the detachment that his colleagues had with the degree of just mortality that accompanied surgery. He didn't like the fact that their patients would get through these procedures that were really traumatic and then die anyway because of the infection that came thereafter. Now, He had a couple advantages that were really amazing. He and his family were Quakers, and because they didn't do a lot of other entertainments like dancing and singing and so forth, they were encouraged to do various scientific pursuits. And his father was actually a really well-known microscopist who solved a lot of technical problems and making microscopy very, very practical. And he started investigating surgical wounds and a lot of different things with the microscope. And he decided that there had to be some tissue-based level where this problem arose. And he was struggling with it for a while until he read the papers by Louis Pasteur, who was describing germ theory and how these little tiny animalcules that were in the air could putrefy wine, kill off silkworms, and other things of that nature. And he thought that maybe this was what was causing surgical infection. So he started looking at the wounds and the various types of infection that occurred and found that these bacteria, but at the time animalcules, were associated with different types. When you had laudable pus, that was caused by a specific type that we now call Staphylococcus. And this is going to be thick, whitish pus that stays near the infection site. It was considered actually a good sign because it doesn't tend to spread centrally. Red, angry, red lines were caused by Streptococcus, and this would be a more problematic infection because it would tend to spread centrally, and the pus was a little thicker but also smelled a little more nasty. And worst of all, if you had gas gangrene, this watery, purulent, just smells like death pus, that was caused by what we now call Clostridium. And he found that you had these specific bacteria associated with the specific types of pus. And the next problem was, well, if that's the case, how do we deal with it? He did some more reading and found that some places had used phenol, at the time called carbolic acid, to disinfect very purulent, nasty sites, fields, wells that had gone septic. And so he thought that maybe this phenol could be used in surgery. So he sprayed down the instruments, he'd spray down his hands, the hands of all of his assistants, they'd spray phenol into the wound as they were working. And it doesn't sound so great now, but at the time, this actually made a huge impact. He studied compound fractures that he'd apply this Listerian technique to, applying the carbolic acid, put the bones back together, seal it up, and found that whereas these had tended to be a death sentence before, because if you have a compound fracture, it's usually caused by something, a rock, a cart, and in the act of getting that compound fracture, you're likely to get dirt or other infective material into the wound. But by using the phenol and wrapping it up and changing the bandages regularly, he had very good success rates and survival rates. And you'd think, once again, that this would be a slam dunk. High success rates, surgeons would adopt it right away. The problem is, this flew in the face of everything a good surgeon was supposed to do. What was a surgeon supposed to be? If you're going to amputate on somebody without anesthetic or keeping the wound open long, you have to be fast. This slowed things down a lot. It made it very ponderous. Phenol is a little bit irritating. It makes the hands kind of turn beefy red. It's a little bit irritating. It's tough to breathe in, smells bad, it irritates the airways. So people didn't like the actual procedure, but he kept on publicizing his results, kept on pushing them forward both in the UK and in Europe, and eventually was able to win people over. Now in America, he had a very vociferous, I want to say enemy, but somebody who disagreed with him entirely. Samuel Gross was in Philadelphia, very famous portrait right here, the Gross Clinic. It's named after him, not because it's grotesque. But essentially, he thought, held the prevailing belief that the problem with surgery and infection was that the wounds were exposed to oxygen, and that the longer they were exposed, the more likely they were to be purulent, and so you had to be fast to prevent oxygen exposure. It's not a bad theory. It's wrong, but it's not a bad theory to experiment on. But he opposed the Listerian technique for a long time. But Lister had something very few of the people in the history of medicine had. He was persistent, he was humble. If you read, there's a book that just came out about him called The Butchering Art. It's really good, I recommend it highly. But as you read it, you get a sense, he's almost like the Mr. Rogers of surgery, just an insanely humane, nice person who didn't give up and kept on pushing to the point where he could make people's lives better. Now his methods prevailed because he had superior outcomes. If people would make the jump to accept germ theory, then his outcomes not only made sense, they were clearly better. He was able to push forward and keep pushing his case forward because he was relatively young. And sadly, a lot of scientific advances get made because the older cohort of people who resist them will eventually die off. And then the younger generation brings things in like hand washing, Listerian technique, and other things that have made big advances in society, mostly because the people who had been against it are no longer around. So we have painless surgery, we have antiseptic, eventually aseptic surgery. Eventually, instead of spraying phenol into the air, we simply found ways to keep infective material from getting into the surgical suite altogether, and that's how we operate these days. So next time you guys are scrubbing in for surgery and it seems like a real hassle to scrub and kind of get under every nook and cranny of your nails, just remember the outcome used to be much worse and you don't want people dying. And that's exactly what you're preventing with this aseptic technique. So, American surgery was really still in the dark ages compared to everywhere else. The high status places for medicine and surgery was Europe, and people in America had gotten off to a good start in Philadelphia, but the Civil War didn't just tank American medicine, it tanked American society, American science in general. That huge cost, that huge mortality just made America kind of a backwater in a lot of ways for at least 20, 30 years. And American medicine became synonymous with basically quackery. You didn't have to have any kind of a degree. You could just go out and claim to be a doctor and start seeing patients. Nobody oversaw it. If you did get training, chances were good you trained as an apprentice for a couple years. Maybe you saw some good cases. Maybe your teacher was invested in teaching you, or maybe they just wanted the quick buck and would give you a rubber stamp on your diploma, and that was it. The people who trained very effectively didn't train in America. They went to Europe. Now, if you're going to go spend 3 years of your life in Europe to study medicine, what do you have to be beforehand? You have to be rich. So this was very much something that only the wealthy and their children could afford to go train in these areas. One of these rich people was named William Halsted. And over the course of his life, and basically because of him, American medicine and surgery went from being very suspect to being the gold standard. Particularly with surgery, Halsted made surgery what it is today. So essentially, he was rich. His family was very wealthy from New York. He traveled to Germany and France and trained there, came back, and he brought Listerian technique with him. He believed very strongly that antiseptic technique would work very well. And when the hospital he was working at refused to give him an area that he could make Listerian or kind of sterilize, he and his friends took up a collection and basically put up a tent in the courtyard of the hospital and made it into a surgical suite for carbolic acid use and Listerian technique. He and his friends were very active at researching, operating, seeing patients. It seems like they had a third end of the candle that they'd found to burn because they were just working nonstop and producing a lot of really interesting results. Surgery was very quick but also very safe because of the Listerian technique, and everything seemed to be going really well. He was on just a rocket ship to the top of the medical establishment. But then something bad happened. He started investigating topical anesthetics, and the topical anesthetic of choice that he started investigating was cocaine. So Sigmund Freud had investigated cocaine and tried to find out a lot about it, and amazingly, he was trying to find every single clinical use of it, but he somehow missed topical anesthesia. Now, obviously I don't have the practical know-how, but apparently if you have cocaine, your mucous membranes go pretty numb. It's hard to ignore that numb, tingly feeling, and yet Freud missed that. But he got enough of the hint of that he told a guy named Karl Kohler, who was an ophthalmologist, that maybe it could be used for eye surgery. And Kohler anesthetized people's eyes and was able to actually then carry out procedures on that. Now just take a second and think about pre-anesthetic eye surgery. You can hold someone's limbs down. What do you do about their eyes? So this was obviously a huge jump forward for the ophthalmology world because suddenly the eyes were insensible, could be operated on, and its use as a topical anesthetic was then investigated. Halsted and his friends started using it to numb peripheral nerves, and in the process said, hey, not only does this stuff numb my peripheral nerves pretty well, and I can use it in surgery, I feel awesome. Let's go party. And so they would be out all night, work all day, take cocaine, get that boost, and they all crashed. And of that crew, really only Halstead came through it with a career intact, but it was at a cost. He was investigating cocaine and trying to describe to people how it was used. And when he eventually got around to writing his findings, it was pretty appalling. And just one quick word, unlike today, cocaine was widely available back then. You could go into any pharmacy and get heroin and cocaine, laudanum, whatever you wanted. It was sold as a tonic for children. So your kids have toothache, give them cocaine. Kids don't sleep well, give them morphine. It worked. But it was incredibly bad, incredibly unregulated. And I'm going to just put up a small excerpt of Halstead's eventual essay on the use of cocaine in surgery. And this is pretty indicative of his state of thought at the time. So just try to read that. So he had crashed. He was unable to function. He was just completely addicted to cocaine. His family and friends kind of were able to try to get him to go clean. He'd relapse a bit. And eventually, out of pity, a man named William Welch at Johns Hopkins gave him an assignment as a laboratory technician, a surgical technician at Hopkins, and he there began to very gradually reestablish his capacity to do surgery, to do research, and he eventually became chair of surgery there when the person who had initially taken the job backed out. But instead of being this rapid-fire dynamo, he was now very slow, very meticulous, but still very, very interested in exploration and research. And he thereafter became the father of American surgery because of the slow but meticulous pace of the procedures he'd do. They were said to be almost bloodless because the minute there was a bleeding artery, they'd be ligated. It'd be tied off instantaneously. And his surgeries were really a massive increase in sophistication because he really investigated the anatomy and microbiology and microscopic nature of all the stuff he would operate on. So he figured out how to do surgery on the thyroid gland for the first time. Was able to come up with the first effective hernia repair by studying exactly how the gut tube herniates out of the body. And let's see, he did the first, what we'd consider to be modern gallbladder removal on his mother, on their kitchen table, because he was visiting family and noticed that she was going downhill, knew that it was her gallbladder, and that if he didn't do anything, she'd die. So operated on her on the kitchen table with the family there as kind of orderlies, and she pulled through. He also is responsible for the first effective mastectomy. Now, Halstead gets a lot of bad press these days because the Halstead radical mastectomy is a brutal, brutal thing. However, you got to put it in the context of the time. At that time, breast cancer was considered to be hopeless, and people would not be operated on most commonly. They'd just be sent home to die. That's what was done with hopeless cases of any kind. When people did elect to do a mastectomy, this illustration is actually very accurate. Spikes would be driven through the breast, ropes tied to the spikes, traction put on the rope, and the breast just kind of lopped off. Now, knowing what you guys know about lymphatics, what do you think of the efficacy of this situation? Terrible. So not only is it traumatizing, it didn't work. That's one reason breast cancer is considered to be inoperable. Halstead looked into the anatomy of it and decided that to address it and make sure that you got the lymphatic system dealt with, that you would remove the breast, the underlying pectoral muscles, and all the lymphatics you could get to in the axilla. And it worked. So take a look at this picture real quick, if you can bear it. And then take a look at the picture that Halstead put together for illustrating the radical mastectomy. Is it brutal? Yeah, but it worked. For the first time, breast cancer was not an immediate death sentence. And not just a death sentence, one that isolated people from their friends and family because the ulcers would be putrefactive, they would just be foul, they'd drain. It was not a pleasant way to go. Now, these days, we obviously have better options. The radical mastectomy is very infrequently done because most of the time we're able to catch breast cancer way before this. But just remember that in its time, this was a big step forward and actually saved lives that had never before been considered savable. So, In addition to all of those things, and a few others I couldn't even mention, he invented the modern surgical residency, where senior interns and senior residents train their juniors, and people get progressively more responsibility as time goes by. He invented rubber gloves. Hooray! Everything I've talked about up until now was all done barehanded. Yeah, we just assume gloves these days, but they weren't around until the early 1900s. And actually, he made them because his nurse, his surgical nurse, got really irritated, red, beefy hands and had a difficult time assisting him. So he talked to the people at Goodyear and actually came up with rubber gloves. They eventually got married. They were a very odd couple. Her name was Carolyn Hampton. She was also kind of New England, aristocratic, wealthy derivation, but they got along very well, but they were a very strange couple. Now, thing about it is, he did a lot of this amazing work, but he did it while he'd occasionally just disappear. His residence needed to be very sufficient because he would simply disappear, sometimes for weeks or months at a time. He'd go to his wife's country estate and they'd just hang out there. They'd find out, oh, is Halstead around? Nope, he's gone. You guys are now responsible. You are in charge of surgery at Johns Hopkins. It didn't come out until well after his death, when another well-known doctor at Hopkins named William Osler published what's called The Secret History of Johns Hopkins, that Halstead had pretty much beaten his cocaine addiction by getting addicted to morphine. So he would go on morphine instead of cocaine because it left him slightly more functional, but it also made him very erratic, and sometimes he would disappear for hours, weeks, or months at a time when he'd go on kind of a relapse. So despite all of that, he was still able to be very productive. But it wasn't a great situation for his students. Now, amongst his many students who went on to found surgical residencies in other places, we've got a few luminaries. I'm not even going to mention all of them, but Harvey Cushing, the inventor of neurosurgery, essentially, was one of Halstead's students. And he didn't get along particularly well with him, but he did get along with William Osler, the other member of the faculty there. And just love this picture on the right. That's a picture demonstrating the craniotomy procedure that Cushing pioneered, but that picture actually looks like his most beloved instructor there. That would be William Osler. So he kind of drew Osler in with a craniotomy, kind of a rough way to say thank you to someone. But he came up with treatments for trigeminal neuralgia. Now, trigeminal neuralgia is, as some of you guys know, tic douloureux, extreme pain associated with the branches of the trigeminal nervous system. What do you think the most common outcome of trigeminal neuralgia was if it's left untreated? Suicide. It's blindingly painful, doesn't allow people to sleep. When you don't sleep for extended periods of time, you make crappy decisions, and people would kill themselves to get away from this pain. He came up with an approach that dealt with it for the first time and gave these people some relief. He did lots and lots of different brain surgeries, worked on hematomas, tumor removals. We typically hear his name Cushing in conjunction with Cushing's syndrome, which is a problem of the endocrine system. But it's got his name because he figured out that you could do procedures on the pituitary gland. So that's how the neurosurgery and endocrine system were really brought together. He performed about 2,000 operations over his career, and brain surgery went from having a mortality rate of about 90% to 8%. Now, obviously, he wasn't the only one working, but he did a lot of the work that made brain surgery feasible. Another student of Halstead's is a guy named Walter Dandy. Now, Dandy was interesting. He was a little bit more of a working class fellow, didn't have the aristocratic background that the others did, and he was always kind of fighting with Cushing. It seemed like a one-sided rivalry. But Dandy was always trying to one-up Harvey Cushing, and he came up with a lot of interesting things. He described how the CSF circulates. He described ways that you could take pictures of the brain by draining the CSF and letting air get in there, so that when you took an X-ray, instead of water in brain with very little interface, you had air in brain, which would let you visualize some of the tumors that might be present in that system. Now, I want you to think about one other thing. X-rays had just become a thing when these guys were working, which means most of the brain surgery they did was not based on imaging. It was based on a very thorough neurologic exam. So think about doing a neuro exam and deciding you need to open up here rather than here. And if you screw it up, you just open up that person's skull to no particular good end. So there's a lot of skill going on, not only on the surgery, but on the assessment of how to do the surgery. So Johns Hopkins remained at the center of surgical innovation, and the next big thing to happen was heart surgery. Now, some heart procedures had been attempted before, but the first one to really take off was due not because of a surgeon's activity, but because of this woman, Helen Taussig. She was a Hopkins grad, had been discouraged from going into medicine her whole life, wasn't considered suitable for a woman, but she kept on fighting the good fight, and did an internship in cardiology, and eventually was put in charge of pediatric cardiology wards at Hopkins. Now, pediatric cardiology, back in those days, the 1940s, it was basically just trying to make these children comfortable until they died. There wasn't much you could do to correct any heart defects at all, especially amongst children. So she became very familiar with how the damaged hearts worked, how the blood flow was aberrant, and couldn't really do anything about it. But she noted something. Her children who had tetralogy of Fallot had a much worse prognosis if they had a closed ductus arteriosus than if they had an open one. An open ductus actually gave them a better prognosis. And she thought that perhaps there'd be a way to surgically create a ductus. So one thing to mention about her that's really amazing, especially in this osteopathic student crowd, is she was mostly deaf. This picture was posed with, well, you're a doctor, put the stethoscope on, examine the kid, but she never really used a stethoscope because she was deaf. She palpated the murmurs and the pulses and the beats of the heart, and she's actually said that, good pediatric cardiologists had to learn to listen with their fingers. She palpated all those little things. So next time murmurs seem hard to hear, think about how hard they might be to feel. So she eventually wrote the textbook on pediatric cardiology. But to get that first surgery done, she had to come up with a way to build a ductus arteriosus. And that's where her expertise fell short. She was not a surgeon, but other people at Hopkins were. In particular, this guy. On the left is Alfred Blalock, a surgeon who'd been at Vanderbilt and was now at Hopkins, had worked a lot on wartime injuries and ways to reduce surgical shock. And he had not just a very good surgical background, he was also a Hopkins graduate prior to going to Vanderbilt, but he had the best lab technician in the world, a guy named Vivian Thomas, here on the right. Vivian Thomas wanted to go to medical school, but all of his savings were wiped out in a financial crash, and he became a janitor and then lab technician at Vanderbilt. And Dr. Blalock realized that not just that Vivian Thomas had great hands, but he was incredibly bright. Somebody who would have been a great surgeon in his own right, except he was black. It was very difficult for him to get the education and get the resources needed to go to school. So he began working as Blalock's assistant and actually went with him to Baltimore. So the procedure began to be worked on by these guys. They'd work on the smallest puppies they could to try to replicate the size of the hearts of the children they'd have to do this intervention on. And quicker than they were ready, a 3-year-old girl named Eileen Saxon needed this procedure done. She had taken a turn for the worse, her ductus had closed, and they said, well, if we don't operate, she's gonna die. So the operation was planned. Here's the problem. Dr. Blalock had done the surgery exactly one time and not successfully. Vivian Thomas had done the procedure many times successfully on their experimental puppies. So in Baltimore in the 1940s, which was unheard of, the chief of surgery at Johns Hopkins did the procedure with his black laboratory assistant standing on a stool behind him, guiding him through the surgery. Don't cut there. Okay, let up the clamp on that a little bit. Need to suture here. And the procedure was done in a very small field. It's a very small patient. And they weren't quite sure that they'd succeeded until, after sealing off one of the last sutures, they saw this little girl go from blue to pink and knew that they'd done it. And they'd built that ductus, put it in there. Now, if this sounds like a good story for a movie, I'm afraid you've been beaten to the punch. HBO put this together a few years ago. It's got Alan Rickman. So if you want to see Snape and Mos Def save someone's life, then it's really a good movie. I was weeping openly at the end, so just be ready for that. So next step was not just doing procedures around these organs and moving deeper into the body, doing abdominal procedures, doing thoracic procedures, doing procedures on the brain. Transplantation was the next big step, and that was done in South Africa. A guy named Christian Barnard did this procedure and shocked everybody. His teachers were working on ways to do heart transplants. Two guys at Stanford called Lowell and Shumway, but Barnard beat them to the punch, and he did the first successful heart transplant. Now on this slide, successful, I think I've got it up there. Yeah, successful has quotation marks around it because the longevity wasn't that great. These guys tended to die after several weeks, but it showed that in theory it would work. Now the problem was we didn't understand the rejection phenomenon. The immune system was not understood to a degree that we could simply do transplants. Kidney transplants between identical twins had been tried successfully, but doing heart transplants was another step altogether. And Barnard and a bunch of people started doing more and more heart transplants, but lost favor with the procedure and eventually disappeared, more or less, because the rejection phenomenon just wouldn't allow it to be successful. But the two guys at Stanford, Lowell and Shumway, worked with cyclosporine and figured out that you could actually get the immune rejection under control by using cyclosporine. And essentially, that led us to where we are today, not just with heart transplants, but with any kind of organ transplant. If we use the immune system properly, tamp it down as we need to, we can allow the rejection phenomenon to not eventually kill the patient. And these days, the surgical procedure is not the problem. The problem is finding enough organs to transplant for the people who need them. So technically the problem's been solved. Now the difficulty lies in getting the procedures the material we need to actually do the transplants and save people's lives. All right, that is pretty much it for History of Surgery, and I'll be back up here tomorrow to talk about I'm going to call missed opportunities. Opportunities we had in medicine to make things better earlier, and we just kind of lost out on. Thank you.